Hi, I'm Eliza, a registered nurse at RMA of New York, and I'm going to show you medication administration techniques.
Preparing the pen. Check the dose display in the Redi-ject Pen. To set the dose display, turn the dose knob in a counterclockwise direction until you see 0. Attaching the needle to the pen. Remove the pen cap and clean the pen tip with an alcohol swab. Hold the outer needle cap in one hand and the pen in your other hand. Place the needle on the end of the pen and screw the needle onto the pen in a clockwise direction until you cannot turn the needle anymore. Gently remove the outer needle cap and place on a clean, flat surface to use later. Removing air bubbles. Small air bubbles in the pen's reservoir do not need to be removed from the pen, but large air bubbles in the pen's reservoir must be removed. If you see a large air bubble, turn the dose knob in a clockwise direction until the dose display reads 25. Carefully remove the blue inner needle shield and throw it away. With the needle pointing up, tap the reservoir with your finger to allow any large air bubbles to rise to the top. Turn the capped needle in a clockwise direction to unscrew the old capped needle from the pen. Discard the needle in your safety container and replace with a new capped needle to complete your injection.
Dialing the prescribed dose.
Turn the dose knob in a clockwise direction until your prescribed dose shows in the dose display. Do not push or pull the dose knob while you turn it. If you pass your dose, simply turn the dose knob back to the correct dose. Injecting. Clean the injection site with an alcohol swab and allow to air dry. Carefully remove the blue inner needle shield and throw it away. Pinch the already cleaned injection site between two fingers. With the other hand, insert the entire pen needle at a 90-degree angle, straight into the skin. Press the injection button all the way in to be sure you have given the full injection. Be sure the dosing window says 0 before removing the needle. Wait for 5 seconds before pulling the needle out of the skin. Pull out the pen needle. Disposal of the needle. Holding the pen in one hand, slip the needle into the outer needle cap. Using one hand, push the capped needle against the surface until you hear a click. Turn the capped needle in a clockwise direction to unscrew the old capped needle from the pen. Discard the used needle in your safety container. Replace the pen cap. After you use the pen and there is still medicine left, store your pen in the refrigerator up to 28 days. Be sure to keep track of how much medication you use daily to be sure that you don't run out of medication.